I'm Grant Blashki, and today we're talking about high blood pressure. First of all, a couple of definitions. Often your doctor will call high blood pressure hypertension, and so some people think it means that they're hypertense, but it's nothing to do with that. It doesn't mean that your doctor thinks you're tense, it's just the medical terminology for high blood pressure. Why do we care about it? Because people generally don't have symptoms, but they're at increased risk of heart disease, of kidney disease, of having strokes, and we know that if we treat it, that we can reduce the risk of those things by quite a lot. So that's really important. So you will have seen a blood pressure cuff like this, or what we call a sphygmomanometer, and your doctor undertakes your blood pressure test. They get two numbers, the top one, what we call the systolic blood pressure, and the lower one, what we call the diastolic blood pressure. And this helps guide the doctor as to what to do. So, if your blood pressure, the top one's 120 and the lower one's 80, generally that's normal and there's nothing for us to do. If your top number is between 120 and 140, or the lower one's between 80 and 90, we call that high normal. So we're not going to do anything drastic, but we'll probably want to recheck it in the next year or so and just see what's happening with your blood pressure. Now beyond that, we start to get into the territory of what we call high blood pressure. So if the top number is between 140 and 160, and the lower numbers between 90 and 100, we call that grade 1 hypertension. And increasingly we go up through a little grading system. So grade 2 hypertension, the top one's between 180 and 160, and the bottom one's between 100 and 110. And then grade 3, the top one's above 180, and the bottom one's above 110. So when your doctor's deciding, well, what are we going to do? Do we need to give some blood pressure tablets? They won't just look at your blood pressure, but they look at what we call the absolute cardiovascular risk. So they look at all the other factors that could affect your risk, such as high cholesterol, your family history, whether you smoke, whether you've got diabetes, your ancestry. Some people from Aboriginal and Torres Strait Islander background might be more at risk. And putting all that information together, the doctor will go, this might be some blood pressure that we need to check. So, just a couple of tips there. Why do we get high blood pressure? Some of us just get it as we get older, and probably a third of Australians eventually get high blood pressure. But there are some secondary causes of blood pressure, and your doctor will think about those. Kidney disease can sometimes cause high blood pressure. There's a whole range of medications that can push it up. Cold and flu tablets, nasal sprays, some of the anti-inflammatory medications, the oral contraceptive pill, and some of the antidepressant medications. So your doctor will want to have a look at that as well. In assessing your blood pressure and what to do about it, it's likely that your doctor's going to want to do a general cardiovascular checkup. They're probably going to want to do a blood test. They might want to do what we call an ECG, where you have stickers on your chest and it gets a good picture of the heart and how it's functioning. Your doctor might want to do some special tests as well. They might want you to get your eyes checked. They might want you to have what we call an echocardiogram, an ultrasound of the heart. And if they suspect that you've got what we call secondary hypertension, they might even want to do a special sort of ultrasound of the kidneys. So your doctor will assess all those things together. So then what to do? There's a bunch of non-medication things that you can do to try and bring your blood pressure down. Regular exercise, about 30 minutes a day. Drop some weight, try and get your body mass index under 25. Waist measurements even more accurate. For men, we're trying to get their waist under 94 centimetres. For women, under 80 centimetres. Reducing salt, under 4 grams a day. Not smoking. So there's a whole lot of things that you can do to try and reduce your blood pressure. And then the doctor will decide, maybe we need to give you a blood pressure tablet. And there's 4 main sort of groups of these blood pressure tablets, and the doctor will take into account all sorts of things like the side effect profile, any other diseases that you've got, any other medications that you're on that might interact. And the doctor will generally start at a low dose and see if it's effective at getting your blood pressure under control. Sometimes they'll gradually increase it. In some cases, if your blood pressure is not going down, the doctor may combine a couple of medications together, and that's quite common if we're struggling to get the blood pressure under control. So there's a couple of important things to remember when you're getting your blood pressure checked. Some people, if we're unclear about whether or not they really have high blood pressure, will suggest that they do some home monitoring. So they might use one of these electronic ones to measure it at home. There's a test called an ambulatory monitor where you wear a blood pressure cuff for 24 hours, and that's quite useful because we can see what your blood pressure is doing during the day and also at night. And in a normal person, the night blood pressure will be quite significantly less than in the day, maybe 10 millimetres of mercury or so. There's a couple of pitfalls to be aware of. Make sure that the cuff is a good size. So we have, some people have got really big arms and we've got a nice big cuff. Otherwise, if we use too small a cuff, we'll be getting high readings. If you're using an electronic measure, it's a good idea to get that checked every 6 months or so and make sure that it's actually calibrated, that it's actually accurate. So there's lots of information there about blood pressure. If you do have persisting high blood pressure, or you've got any of what we call end organ damage, where the blood pressure is starting to affect your heart or your kidneys or your eyes, your GP will generally get some specialists involved. So I wish you well with your blood pressure from familydoctor.expert.